Good morning, everyone, and again, thank you to all the frontline people that are keeping us moving in the right direction. Thank you to all the people that are social isolating. Thank you to everyone that's doing what they should be doing. Thank you. Unfortunately, we had another person pass away last night. A 70-year-old, a male in his 70s with underlying health issues. So that brings us up to 23 now. My heart and condolences goes to the family, to all 23 families, but especially to the new one and to their loved ones. So we're thinking about you, and you're in our prayers. As of today, we have 656 positive cases. Obviously, it's only going up by 5, so which is good. 784 people that are under mandatory quarantine, 38 people under precautionary quarantine, and our residents at Shaker Place stands at 18 residents and 7 employees. Actually, that went up 8 employees, one other person. The people that have completed quarantine stays the same right now. The name that hasn't changed since yesterday, and we still have 35 people that are hospitalized. Out of that, it's 5.34%. That's up from 4.9 yesterday. So that number changed a little bit. And we have 9 adults that are currently in the ICU. That's up from 7 from yesterday, so that's up 2. So that changed a little bit. But, we still have the testing going on at Albany to remind everybody. And we also have the walk-up testing that we provided here with the mobile site testing. So you can call that number at area code 518-465-4771. 518-465-4771, and please just remember, I know everyone wants to get tested, and we'd love to test everyone, but we can't. You have to have underlying issues, temperature, and some other things. Again, if we had enough tests to do everybody, we would. We don't, and we have to take care of the people that have signs and symptoms, not just because you want to get tested and get that relief from yourself, which I totally understand. That being said, it takes a partnership to do a lot of things, right? And when we lost our testing site a couple weeks ago, one of the priorities of Dr. Whalen and I was to make sure we got testing up and running. And to all my staff, I can't thank them enough what we've done with the walk-up clinics. And again, we're the only county doing that type of stuff. But we also have to look at the whole county, because I represent the whole county. So working with Paula Mahan, our great supervisor in the town of Colony, who wanted to get testing going in the town of Colony because they do have a certain percentage of seniors and people with underlying issues. And I have to commend you, Supervisor,
Thank you.
For wanting to get this done and working with a variety of other people, and I'll get to that in a minute. But I do want to thank Rite Aid and the U.S. Department of Health and Human Services to offer testing in 8 states across the county, and that our Rite Aid at 1863 Central Avenue in Colony will be one of these sites. So in a partnership with Rite Aid and the U.S. Department of Health and Human Services, we will be providing another drive-up testing in the town of Colony. And again, I can't thank Paula enough. This will start this Wednesday. This Wednesday. You won't even have to leave your car. You can drive up, stay in your car, and it's a self-swab nasal test. Rite Aid physicians are going to be doing it, so you don't even have to get out of your car. They'll give it to you. You just do a little swab, you give it back, and you'll be able to get tested that way, which will be good. The test, when the test is completed, like I said, you'll get your results back by email, or by phone call, but more likely by email. But you can register for the Rite Aid test at www.riteaid.com. That's www.riteaid.com. Here's the other thing. There'll be no cost. There'll be no cost to the individuals who go up and get this test. If you meet the CDC testing guidelines, there'll be no cost to you. Same thing we did with our walk-ups. I don't want people to worry about insurance. I don't want people to worry about whether or not they can pay for it. If you meet the CDC guidelines, or you don't have insurance, we're going to pay for it. We're going to pay for it. And this testing is going to go from 9 a.m. to 5 p.m. 7 days a week. That's 9 a.m. to 5 p.m., 7 days a week, and they expect to do about 200 tests a day throughout their locations by appointment, online, appointments only. So you're not gonna be able just to drive up and say you wanna be tested. You have to go online and set up an appointment to get it done. And when you go to your appointment, you'll have to show an ID or also be over the age of 18. So just think about that too when you go. I can't thank Paul and Mahan for bringing this in. We've been talking about this the last couple of weeks as Dr. Whalen and I were discussing how do we get testing up and running again. And I do want to thank the legislators Peter Tunney and Patty Lockhart and the minority leader, Frank, and obviously Melissa Jeffers, Linda Murphy, and Jill Penn, and Dave Green from the town board, making this possible. But I do want to say to Paula, thank you for your leadership on this. And Paul Mahan, please, if you want to add to this.
Thank you so much, Dan, and thank you for everything that you've been doing to help us get through this crisis. And as well, thank you so much, Dr. Whalen, for all your guidance. These briefings are so helpful to us in the town of Colony. This new site that County Executive worked with me to get this set up, along with Rite Aid and others that are making this possible, is really, really going to be beneficial to us. We have a very large population in the town of Colony. We are the most densely populated town in the capital region with over 83,000 people. And 20% of our population are seniors. And they are, as we know from the data, a very vulnerable population. So this not only is going to give people peace of mind that will need these tests. They will be available, as Dan said, in the town of Colony at the Rite Aid on the corner of 155 and Central Avenue. But it's also going to help us to gain more data to really be able to have more accurate numbers and to be able to treat properly and to trace where these people are that have been affected by COVID-19. So for us, it's just a real benefit. And so I thank you so much, Dan, for everything that you've been doing, and our hearts go out to all the families that have been affected by this, losing loved ones and dealing with this. We certainly are living in a new period of time here, and we're going to have to continue to work together to be able to adjust. We're learning, just like everyone else is, as the days go on. The county executive has been just an outstanding asset for us, along with many of the other agencies and staff members in the county, and the governor and his staff as well. So we need this consistency. We need the help. We're all in this together. And Dan and I have worked side by side for many years now, and things work better when we can all work together. So I can't thank you enough. Thank you so much.
Thank you, Supervisor, and I can't thank you enough for making this a priority within your administration to get testing done in the town of Colony. So thank you for that and helping us. I also want to thank the Sheriff's Department. They'll be providing the security. They've been doing the security at all of our mobile testing sites, and this one too, they'll be doing it. So Sheriff Apple and to his team, thank you so much. And to everyone that made this possible, again, Rite Aid, and please go to their website, www.riteaid.com. Set up your appointments. It starts Wednesday, and it's going to go 7 days a week. So again, no cost, people. If you meet the CDC guidelines, no cost, and that's so important too. And also, I know that PVA will be announcing. They announced a little bit, but they're having a bigger announcement at 2 o'clock. So I don't want to take that away. But this is great news, not just for this company, but for here in Albany County, highlighting another company that switched gears in the midst of this crisis and stepped up to the plate. So thank you to PVA and all the workers there for everything you're doing. You're doing a great job. And two, please remember, social isolate, stay home. I know people are getting the urge. It's going to be nice out today, but if you go out, you got to wear the mask. If you can't keep 6 feet separation, so keep that in mind. So the mask only has to be worn if you can't keep 6 feet isolation, not unless I'm wrong on that, Dr. Whalen, you can correct me on that after. It's, please just do what's right. Do what's right. And I don't know if we got Congressman Paul Tonko. Can't get him up on the phone. He's on a conference. I do want to thank, hopefully he'll get on before this is over with, before I turn it over to Dr. Whalen. Congressman Tonko, I feel like him and I are joined at the hip lately because of what's going on the federal side, and I want him to talk about the fourth stimulus package that the president's talking about putting it out and how that'll affect our county going forward and our state of New York. Paul, I can't thank him enough for all the work that he's done on that. So hopefully we when he gets off his other conference call, we can get him back up. But I'm going to turn over to Dr. Whalen, who has been doing a outstanding job, her and her team down there at Department of Health on all this. And Dr. Whalen.
Thank you, County Executive McCoy. I'm very happy to learn that this additional testing site is going to be up and running, and I think that this really highlights the important work that can be done when we collaborate within the community. There's not just one way to get testing done. You know, when this started out, it was, how will this be done in providers' offices? How will it be done within hospitals? And as we start to see these conversations take place at a local level, we learn there's many different ways that this can be done. And there's ingenious ways that this is being done. And we know the importance of testing. So this is a phenomenal development, and again enables us to expand the testing that we're doing across Albany County. Testing is really the cornerstone of disease control because it enables us to early identify cases and isolate them so that they do not spread COVID-19 to others, and also to quarantine contacts. So these are the cornerstones of controlling communicable disease, and it is great that we are able to have access to this in Albany County. We've been looking closely at the numbers of people testing positive, at the numbers of people that are hospitalized, and tomorrow we hope to talk more about how we want to represent that to the community. We've been talking about rolling this out online. Our numbers at the moment are steady. We're getting positives every day. We are seeing patients in the hospital, but we are not moving towards a large spike, and we're wondering what this means. And the only way we can find out what this means is to continue to follow the data along. I think what I could deduce from the data is that the social distancing that we have been practicing is working to a certain extent in halting the disease spread. It is essential that we continue social distancing. It is essential that people know the importance of masking when they are in public and are not able to maintain social distance of 6 feet. It is essential that people continue to remember the importance of hand hygiene and the importance of staying at home if you're sick. And if you're sick, you should be tested. So please reach out. We remain a source of information for the public that has questions on any symptoms they may have, on where they could be tested. I wanted to make a couple of additional comments as well. I got an inquiry over the weekend about someone who had heard something on social media about someone who was infected at a public place, and could I confirm or deny? And the individual said, well, if it was true, the health department would issue a press release. So I wanted to talk a little bit about how we investigate cases and determine whether a press release is necessary. When we investigate cases, what we do is interview very carefully the contact, the case themselves, and identify their contacts. If the case cannot give us all the contacts, if the case has concerns that they may have had contact with people that they don't know or that they cannot identify, or it was a public space, in that situation we issue press releases. Because in that situation we want to make members of the public aware of a potential risk, and we want them to call us so that we can follow them along and make sure that they undergo precautionary quarantine and are monitored for symptoms. If, however, it is a large place and that individual has been working in, say, a back room somewhere, and they only had contact with 3 or 4 individuals, and we know that to be the case, and we have investigated that from multiple different fronts, in that situation, we do what we always do. We identify the contacts, ensure that they're quarantined, and proceed from there. Please be aware that when you see something on social media, it is likely something that we are aware of, we are investigating, and if there is a need to reach back to the public, we will do. The good and the bad thing about social media is a lot of times people can get that information out more quickly than we can conduct an investigation. It usually takes us a day or 2 to get information that we need to make a determination like that. The second thing that I want to say is that I don't think at this point the public should be relying on press conferences to think that this is their only risk. People should be under the assumption that if they go to a grocery store, any large store, any public place, that you are currently under risk, and mitigate your risk the way you know how to do. Wear a mask. Make sure your hands are clean, and try to maintain social distance. These are the best protectors, and this is the way that the public can protect themselves. I also wanted to talk a little bit briefly about the initiative that was launched by the governor yesterday, which I think is a very important initiative looking at antibody testing. So antibody testing, as we've talked about, is not the same as diagnosing COVID-19. What antibody testing does, it's a test, a blood test, that will let you know if you have antibodies to COVID-19. What antibodies to COVID-19 mean is that you have been exposed to the disease and your system, your immune system, has created antibodies against it. We know that there are individuals that have asymptomatic COVID infection, and what this study in part is designed to do is to determine what the incidence of people that have asymptomatic disease is. So they are partnering with price choppers across the state and looking to do finger sticks on individuals that have not been diagnosed with COVID-19 to try to get a determination around percent positives. And this will give us a marker and a discussion around what we can think may be an approximation of a rate of individuals who have asymptomatic disease. This is helpful to us going forward. There is a second initiative that they're launching to do a similar outreach with healthcare workers, and I think that in the coming days and weeks, this information will give us a lot of data that is going to be very important going forward in the discussions that everybody is concerned about of how we launch back into the workplace, how we restart life. That is going to have to be informed by this evidence. So it's very good that we're going to be able to get this along with the testing that we're doing. Thanks.
Thank you. We do have Paul Tonko, our congressman, up now, so this is good.
Okay. All right. Hey, thank you. Thank you for the opportunity to join you with all of the technology ups and downs.
I'm glad that you're here, Congressman. If you want to give an update what's going on with the stimulus package to everyone, I would appreciate it.
Sure. As you know, Congress has already passed three bills that will address the pandemic. The last being the CARES Act, which is now being worked on in an interim model because, as we know, a great amount of the money, or all of it, I should say, $359 billion, was released in 14 days. So the efforts to address that had the Secretary of Treasury asking Congress to offer some $250 billion more for the program. Our encouragement, our challenge here was to make certain that not only do we address small business, which is important. I know that we have to address our small businesses. They're the backbone of our economy, but I think it's also important to have assistance to our hospitals and to our local governments and our state governments to make certain that all of these dynamics are addressed, from small business to the hospital and nursing home settings to state and local governments that need assistance. And so as we speak, there is a near agreement. I would think we could strike that item today or tomorrow, and they are going to allow for, in the agreement as we speak, it could always change, there are efforts, a sizable investment in testing, a sizable investment in hospitals, and our nursing homes, and an investment in the Paycheck Protection Program for small business, and the disaster aid that goes to small business. Unfortunately, at this point in time, the Republican leadership in the Senate, and I think the Republicans in general, are not inclined to support state and local government funding in this interim package. I am being informed that they're going to punt that to the fourth version, the fourth iteration of an assistance package.
I'm sorry, I know initially they had the funding going elsewhere, and I want to thank you for your leadership in changing that bill, and your leadership on a national level, not just here in the state of New York, Congressman, to make sure that these issues are addressed, especially when our governor's calling on more bailout from the Trump administration and from the federal government, and counties too, counties, cities, and villages. Things are going to be tough because of the economics, or the economy being shut down. So I do want to say thank you for your leadership.
Well, I know that you supported the efforts we made in our delegation letter to Speaker Pelosi, encouraging that money go directly to local governments, because they are witnessing skyrocketing costs. And of course, as we know, the revenues are falling through the floor. And so it's important for us to address the needs of local governments. Certainly, we're addressing not only services, which are important with the local governments and the hospitals and nursing homes, but we're talking about jobs. We're talking about those frontliners. We're talking about firefighters and EMS and EMTs and police officers and the like, law enforcement individuals, a whole host of services that are provided. We need to address that for both of the causes, challenging and defeating the pandemic, and making certain that we underpin and provide for the recovery of the economy. Both are important, but we cannot go forward without addressing the pandemic. And you and your county bureau, health bureau, Director Whalen, Dr. Whalen, have been tremendous. I thank you for the work you're doing in providing for taking testing to those who can't travel to the UAlbany site by partnering with Whitney Young. I thank you for advocating on behalf of the testing being done at UAlbany. So it's about testing, and it's been echoed over and over again. We cannot resolve this unless we put together appropriate levels of testing kits, getting those to the most in need, and providing for a democratic data outcome. Those data are very important to making certain that we pinpoint how best to address this pandemic. Without that testing kit availability, we're not going to be able to go forward as effectively as we should. And also to make certain that personal protective equipment, we know that that is incredibly important for the response here, to make certain that masks, the R95s and the N95s and the gloves and the gowns are all very important. So this is something that we've written to Vice President Pence as the leader of the task force about. We are concerned that there's not an aggressive approach to getting to the states and the communities the equipment they require. We've encouraged them to not only implement the Defense Production Act, but to do it robustly, to make certain that we develop these respiratory masks, and that we make certain that that the testing kits are available, and that again we fight for those efforts for local and state governments to make certain that again services are provided and employees are keeping their jobs.
Thank you, Congressman. I can't appreciate what you're doing for us. And as President of County Executives of America and President of NISAC, We thank you, and NACO thanks you too for your leadership on this bill, and looking forward to working with you to try to get some aid to the state and to the counties with the next stimulus package bill. I don't know.
Well, I think.
But I'm sorry.
No, I was just going to say, Dan, that as county exec, you know that it's important for all levels of government to work together and to work that government focus with that of the private sector. Then, as community, respond fully to all of that. And in regard to the N95 respirators, you know, there was somehow there was a missing link as it related to respirators when they provided for liability protection for personal protective equipment. And so I partnered with a Republican, Don Bacon from Nebraska, where we got a bill together that way before this crisis started to provide for liability protection for manufacturers that are producing those respirators. And with his help, with a bipartisan approach, and with the president, frankly, signing on, we're able to include that so that one of the biggest manufacturers in the country has gone from 6 million to 31 million masks. So it can be done when we work together, but it is so important that the feds lead here, that they make certain we have the testing kits and the equipment that we require, and that the frontliners are protected, and that we have the demographic data that can provide the best opportunity to pinpoint where we address where we send those resources and how we best address this pandemic.
I agree, Congressman. It's about partnerships right now. It's not about party lines, and I can't thank you enough for that. I don't know if the press has any questions for the Congressman. If you do, you got to use this mic so he can hear you. I'm going to have Mary bring it around.
Questions? Reporter.
Congressman, it's Daryl Camp from Talk 1300. The governor has
Yes.
said on numerous occasions that the previous bills have been woefully inadequate for the state of New York. Do you agree with that? And he said he'd be speaking with the federal representatives. Has he been in contact with you?
We have been in contact with the governor. We're working very hard to get that state and local government funding. As I indicated, the Republicans are not inclined at this point to include it in the interim package as it relates to the CARES Act, but we're hoping that a fourth iteration will include that assistance to state and local governments. We want to make certain that some of our smallest communities get direct aid in that package, and that our states, like New York, that has been this epicenter of the crisis, be treated fairly. And so I think that there's great unanimity in terms of the delegation, and we're moving forward in a way that I hope will produce on behalf of our states and local governments.
Hi, Congressman. Josh Morrell from Channel 13.
Hey, Josh.
Quick question. What is your opinion on some of the Republican congresspeople that want to investigate the governor on the shelter-in-place orders? Do you have any comments on that?
I think that the governors are acting in the best interest. They're providing for a bit of physical distancing so that we stay socially connected but physically disconnected, so that we're not causing a spread of this virus. I think that I think that the states are where we've seen some of the best results had strong executive decisions that made certain that we were protected and using the best preventative therapies that we can muster.
Thanks, Mayor.
If we don't, again, I was just going to also include, if we don't see this as a community response, we are going to fail in the attempt. This is a pandemic that has been worldwide. We see what happens when there's an aggressive approach taken, when everyone works together. It is important here for us to let science rule and to make certain that everyone works in tandem, governed and led by science.
Thank you, Congressman. It is about the tangible results at the end of the day, and I can't thank you enough for your leadership, not just here in the state of New York, but on the national level. Thank you. I appreciate it.
My pleasure.
So I just want to remind everyone before we end, again, please, if you live in the town of Colony or not live in the town of Colony and you want to drive up, www.riteaid.com. It's going to be open 7 days a week, 9 a.m. to 5, 7 days a week. So please make that appointment because you can't just show up unannounced. Also, just as always, our mental health hotline, 269-6634. Please remember to call for anything, and then the 211 in New York State hotline number.